Hypoxia. Hypoxia is defined as reduced availability of oxygen to the tissues. Hypoxia is defined as reduced availability of oxygen to the tissues. Hypoxia is classified into four types. Number one, hypoxic hypoxia. Hypoxic hypoxia means decreased oxygen content in blood. Hypoxic hypoxia means decreased oxygen content in blood. Causes for hypoxic hypoxia: low oxygen tension in inspired or atmospheric air, which does not provide enough oxygen. Low oxygen tension in inspired air, which does not provide enough oxygen. High altitude while breathing air in closed space. Respiratory disorders associated with decreased pulmonary ventilation. Asthma, depression of respiratory centers, pneumothorax are the reasons for hypoxic hypoxia. Hypoxic hypoxia, decreased oxygen content in the blood, causes low oxygen tension in the inspired air, high altitudes, that while breathing air in closed space, that respiratory disorders associated with decreased pulmonary ventilation, asthma, depression of respiratory centers, pneumothorax. Number two, anemic hypoxia. Anemic hypoxia is a condition characterized by inability of the blood to carry enough amount of oxygen. Anemic hypoxia, inability of blood to carry enough amount of oxygen. Causes for anemic hypoxia: decreased number of RBC. RBC decreases in conditions like bone marrow diseases, hemorrhage, decreased hemoglobin content in the blood, formation of altered hemoglobin like methemoglobin. Causes for anemic hypoxia: decreased number of RBCs. RBC decrease in conditions like bone marrow disease, hemorrhage, decreased hemoglobin content in the blood, formation of altered hemoglobin like methemoglobin. Then next, stagnant hypoxia. Stagnant hypoxia is the hypoxia caused by decreased velocity of blood flow. Stagnant hypoxia is the hypoxia caused by decreased velocity of blood flow. Causes for stagnant hypoxia: congestive cardiac failure, hemorrhage, thrombosis, embolism. Stagnant hypoxia, decreased velocity of blood flow due to congestive cardiac failure, hemorrhage, thrombosis, embolism. Histotaxic hypoxia. Histotaxic hypoxia is a type of hypoxia produced by the inability of tissues to utilize oxygen. Tissue. Histotaxic hypoxia is a type of hypoxia produced by inability of the tissues to utilize oxygen. Causes for histotaxic hypoxia. Histotoxic hypoxia occur due to cyanide or sulfide poisoning. Histotoxic hypoxia occur due to cyanide or sulfide poisoning. These poisonous substances destroy the cellular oxidative enzymes. Poisonous substances destroy cellular oxidative enzymes. Effects of hypoxia. Effects on blood. Hypoxia induces secretion of erythropoietin from kidney. Hypoxia induces secretion of erythropoietin from kidney. Erythropoietin increases production of RBC. This in turn increases the oxygen carrying capacity of the blood. Erythropoietin increases production of RBC. This in turn increases the oxygen carrying capacity of blood. Effects on cardiovascular system. Increase in rate and force of contraction of heart, cardiac output, and increase in blood pressure. Effects on respiration. Initially, respiratory rate increases due to chemoreceptor reflex. Later, the respiration tends to be shallow and periodic. Finally, the rate and force of breathing are reduced. Effects on respiration. Initially, respiratory rate increases due to chemoreceptor reflex. Later, the respiration tends to be shallow and periodic. Finally, the rate and force of breathing are reduced. Effects on digestive system. Hypoxia associated with loss of appetite, nausea, and vomiting. Mouth becomes dry and there is a feeling of thirst. Hypoxia associated with loss of appetite, nausea, and vomiting. Mouth becomes dry and there is a feeling of thirst. Effects on kidneys. Hypoxia causes increased secretion of erythropoietin from the kidneys. Effects on central nervous system. Individual is depressed, fatigue of muscles are common in hypoxia, sudden loss of consciousness. If not treated immediately, coma occurs which leads to the death. Then central nervous system, individual is depressed, fatigue of muscles are common in hypoxia, sudden loss of consciousness. If not treated immediately, coma occurs which leads to the death. Treatment for hypoxia. Oxygen therapy. In a hypoxia, oxygen therapy is 100% useful. Oxygen therapy 100% useful in hypoxia. In anemic hypoxia, oxygen therapy is moderately effective to about 70%. Anemic hypoxia, oxygen therapy is moderately effective to about 70%. In stagnant hypoxia, effectiveness of oxygen therapy is less than 50%. In stagnant hypoxia, effectiveness of oxygen therapy is less than 50%. In histotoxic hypoxia, oxygen therapy is not useful at all. It is because even if oxygen is delivered, the cells cannot utilize oxygen. So treating the underlying cause behind the hypoxia is the definitive treatment. Treating underlying cause behind the hypoxia is the definitive treatment. So once again, hypoxic hypoxia, decreased oxygen content in blood. Anemic hypoxia, inability of the blood to carry enough amount of oxygen. Stagnant hypoxia, decreased velocity of blood flow. Histotoxic hypoxia, inability of the tissues to utilize oxygen.